Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. Aren't you beautiful today?
Oh, thank you.
Every day, right?
Well, I do my best. My best.
Is it all attitude?
It's all attitude. It really is. Attitude of gratitude.
Yeah, that's
I knew
right.
you'd like that. So how are we going to help our listeners today? Because we want our listeners to feel as good as we do.
Well, we've done this radio show for, my gosh, about 20 years or so. And I've been doing this.
25, I believe.
Well, the work I've been doing is over 25 years.
Yeah.
Using regenerative medicine, which has morphed throughout the ages from the old prolotherapy days to now we use PRP, platelet-rich plasma. It's platelets from the blood. And stem cells we can take also. And they're healing agents, and they stimulate tissue to regrow. So wherever you have musculoskeletal pain, that's orthopedic pain, instead of having a surgery, we implore you to consider doing something natural and conservative, which is the work that I have always done since my residency at UCLA. Some patients come and they go, I went to USC, I don't like you. People are very funny about their schools. And I tell them, well, I went to USC also. Believe it or not, I was a lawyer way back. And about 10 years into law, I did a master's of taxation at USC. So, to me, schools are schools. I love them all. I've been to lots of schools. I had college level and post-grad level for 22 years. So had a lot of degrees. It doesn't make me any better than anybody else. I don't think the degrees make the person. But I've just always been curious. I always study. I'm always learning new things. And the thing that has always worked for me, because I was trained in orthopedic surgery during my med school days and internship, and I was going to be an orthopedic surgeon until I had one on my right shoulder.
Oops.
And it didn't work out well. And I then learned about 4 years later how to heal it. And that was back in the prolotherapy days. I injected my own shoulder with concentrated dextrose, that's sugar water, and a local anesthetic. And it healed overnight after a surgery botched it up. So that was a real wake-up for me. I did my wrist also that healed very quickly. And since then, more recently, I've done platelets and stem cells in both my knees, both my shoulders. I've done, let's see what else, also done regenerative medicine on my elbows and my wrist. What else? My neck and back were done by other doctors because I can't reach back there or see that. But in our practice, that's me and Dr. Grove, Dr. Thomas Grove, and you can look at us on the website at www.jointrehab.com. Dr. Grove is a newer associate who is really, in a sense, better trained than I am. My training came intuitively. I did it on my own, just experimenting on my own body. Whereas Dr. Grove is fellowship trained. He's one of the best experts, probably in the country, on regenerative medicine and using ultrasound to guide the needle to see where it's going. And if you're going to doctors who are injecting you with PRP or stem cells and they're not using an ultrasound, they don't know where that needle is going. I am sorry. So there's some areas you don't need to use an ultrasound, but Dr. Grove uses it all over the place, and he is one of the best injectors I've ever seen. He is an ex-football player with the Nebraska Cornhuskers. He was captain of his team. So he's a big dude, handsome guy, a lot of fun, great personality. All the patients love him. And he's doing all the injections now. I'm just managing the practice. And he was very well trained. I also trained him in my methodology so patients could cross over and not be getting different types of techniques. So I love the guy. You'll love him too. And you can go to www.jointrehab.com and you can read his story as well as my story. And there's endless scientific studies on that website that will introduce you to regenerative medicine and what works, what doesn't work. And there's also, if you happen to call in right now and you want to talk to me live, the phone number to the studio is 866-870-5752. I'm going to repeat it while you grab your pencil. It's 866-870-5752. If you call in, I'm going to send you postage-free a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword was done by Suzanne Summers. God bless her. Rest in peace. And she was a big loss to the medical field as far as I'm concerned. She taught people all over the world how to heal naturally. And she had a long struggle herself medically and finally succumbed. She was a couple years older than me, and we were very, very close friends. I've injected her and her son Bruce, who was an avid biker back in the day and had lots of injuries. And her granddaughters I've taken care of and their family and friends, and we just had a great relationship. And she wrote many books. I don't know if you guys know this, but Suzanne Summers wrote probably about 18 books on medicine. And in a couple of them at least, she's written chapters about my work in regenerative medicine. And God bless you, Suzanne Summers. So what else? If you want to call the office, you can get a free consult with my staff there. And the phone number to the office is 800-300-9300. That's a free phone consult. That's not to come in the office. We'd love to see you also. But if you want to just call the office and get a free phone consult with the staff, the phone number to the office is 800-300-9300. So, Nita, anything you want to say before we move on here? And
yes.
I want to talk about the vampire facelift and restorative hair, regenerative medicine on the head also.
Yes, I'd love for people to call at 866-870-5752 because you get a free book today.
And Nita knows that I'm going to needle her.
Yes, that's true.
With terrible dad jokes.
But you didn't let me say what the book is.
Well, tell him.
Okay, the book, this is Dr. Darrow's latest because he's written others. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it has 264 scientific studies. And as mentioned earlier, Suzanne Summers did write the foreword to the book. And in her last book, A New Way to Age, she did a chapter on you.
Yeah, great. It's about 19 pages about regenerative medicine and how it's worked with her and her family and her friends. So I'm going to go to a question, if you don't mind, Nita. I'm going to talk first about actually, we can also regenerate the collagen in the face, and that's called the vampire facelift. It's very simple. We just numb up the face, do the same type of injections as I do on the musculoskeletal system, all the joints, tendons, ligaments, really from head to toe. But it can also be done on your face to make you young again, make you look really young. And a very simple procedure. We also can do this on the top of the head to stimulate the follicles, to regrow hair. It's not going to work very well on Dr. Phil, poor Dr. Phil. But if you're losing your hair, we also can check out the hormones to see if you're having a imbalance in the hormones or problems with low iron or maybe low thyroid, things like that can also affect hair growth. We can check all that out for you. So this question that came in is called failed treatment foot pain. So people email me all day long through the website. If you go to www.jointrehab.com, every single page has a spot to email me, and I answer every single email that comes in. We have emails from all over the world every day. So this person wrote, "Hi, I have had long-lasting pain on my foot for over a year. Haven't had any relief despite resting it, trying Shockwave, that's ultrasound, new shoes, custom orthotics, etc. I am a runner and am desperate to find a solution. I'm interested in learning more about whether my specific injury could be treated by PRP or stem cells or both." The answer is, I don't know. And the reason is this person hasn't told me really what the diagnostics are about. Typically, with someone who's having orthotics made, it could be a plantar fasciitis. That's the ligament on the bottom of the foot that attaches to the calcaneus bone. And people often will get a little spur there. And then they think that it's the spur that's causing the pain, but it's not. The spur is a result of tension between the ligament and the bone. So we call that an enthesopathy. And with constant running, which this person does, I'm a runner also, I've had this a bit, but a lot of times it won't go away. And what we do for that is we use the ultrasound, and we can see where that attachment is, see if it's torn, or see if there is calcification, which can become a spur over time. And we can inject right on that spot. So it's a real simple injection to do. We do these all the time. It could also be, I don't know where the pain is coming from with this person because they haven't told me other than their foot. It could be an Achilles tendonitis. It can be where the Achilles tendon attaches to the back bottom of the foot. And those things we heal all the time also. It could be a bunion. That's arthritis in the first metatarsal phalangeal joint in the foot. And we work with those all the time. It could be a metatarsalgia, which is pounding on the bottom of the foot, and we heal those all the time. So when I say we heal those, I'm not promising you anything. A doctor cannot promise anything to any patient and be confident that what they do is going to work. As I said, I learned about orthopedic surgery. I did tons of surgery during med school, during my internship, and during my residency at UCLA. And, I didn't find that anybody could promise anything and get away with it. So I never promise anything. I have a consent form that says there are no guarantees. Please don't come to us if you want a guarantee. We have had patients come in and say, well, I don't want to be treated unless you can guarantee the results. And I said, good luck. There's no doctor that should ever guarantee anything. We never know. And there are many cases that we think we can help and we can't. With the patients that we choose for the syndromes they have, we usually can heal them. I'd say there's an 80-90% chance, but there are people that fail the treatments. The failures for the regenerative medicine treatments of platelets and stem cells are typically not the doctor's fault in our clinic. They can be with other clinics if you get a doctor who doesn't know what he's doing or doesn't use ultrasound. But most of the failures come from the patient not listening to what we want them to do after injections. And number one on the list is overactivity. That means, let's say this person comes in who's a runner, we inject the foot and they go out and run the next day. Well, what do you think is going to happen? They're not going to let the healing take place. They're not going to let the tissue growth take place. Another reason could be taking anti-inflammatory medicines like ibuprofen. Those block healing. They block the regeneration. They block the sequestering or the gathering of fibroblasts that are cells that actually create new collagen growth, and collagen is the number one constituent of cartilage. So let's say this person had osteoarthritis in the foot, and most orthopedic surgeons don't think there's anything you can do about osteoarthritis except cut it out, oftentimes replace the joint. Well, I don't find that necessary. I find that when we inject the area, we can regenerate the cartilage. And I was talking about this back in medical school, and I was threatened by the professors to be thrown out of medical school because they were not up on what's going on. And they said, I better shut up because what I said wasn't true. Well, now we know it's true. It's been studied over and over. And my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, has 264 studies about regenerating tissue. So we know it's real. And, honestly, the reason I wrote this book is because I used to lecture all over. And when I talk about regenerating tissue and the healing that would take place by simple injections, there would always be a couple of orthopedic surgeons who would create a real havoc during my lectures and say, well, you can't regenerate tissue. And I'd say, yes, you can. We do it all day. And now I went out, I did the research, I put it in a book, and there's probably more research being done on regeneration of tissue than anything else on the planet. I know that's a bold statement, but everybody is learning more and more about how stem cells work. In my humble opinion, stem cells are the answer and will be the answer to just healing about everything in the body. We're not there yet with disease things, but with arthritis and enthesopathies, which is most people's pain in orthopedics. It's where muscles, tissue of any sort, tendons and ligaments, attach to bone. That's typically very easy to heal. So let me see what else is going on here. I'm going to give out the phone number. If you call me, I'm going to mail you out for free. I'll pay the postage, a copy of my hefty book here. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you want to talk to me live right now, the phone number to the studio. Write this down. If you're driving, please pull off the side of the road and get off your Bluetooth if you can so we can hear you. The phone number to the studio is 866-870-5752. And if you want to call the office and get a free phone consult with my staff, the phone number you can call right now, there are people there, is 800-300-9300. And if you're shy, you just want to email me, go to the website, www.jointrehab.com. www.jointrehab.com. There's a spot to email me on every page. Needy, got anything to say, or should I go to another question?
Go to another question, and then let's just give the phone number out again.
Oh, my goodness. You don't want those jokes, do you?
Well, I think what you're saying is all very interesting, and people are listening. But we are now ready for callers at 866-870-5752.
All right, here's a question.
Oh, okay.
This says, failed spondylolisthesis, avoiding fusion. Let's see what they say. I'm 68. I'm not going to say which doctor they saw. Has diagnosed me with level 1 spondylolisthesis. Big deal to me. That doesn't mean a thing. That means a little bit. Listhesis is a slipping, and spondylo is the spine. So it's a slipping of one vertebrae over the other. A level 1 is nothing at all. You'd have to be up to a high level, like maybe a 3+ or a 4, to have that cause a problem, which would be a stretching of nerves. So in 2022, my doctor did a laminectomy, which failed. Laminectomy is cutting out of the lamina, which is a piece of the bone in the back of the vertebrae that covers the nerves, which failed to reduce the pain of spondylolisthesis. So here's the problem. This person was told spondylolisthesis is causing the pain. I'm saying it's not causing the pain. It never did. So why would the surgery help? It wouldn't. He now recommended TLIF surgery to fix the pain. That's a replacement of a disc. That's a bad surgery in my book. I know a lot of people do them. When patients come into the office, what I find is most of these surgeries are failed. Let me actually look up, because I don't do surgery anymore, what TLIF actually stands for. I'm in front of my computer, and I'm going to do something you guys should do too. If you go to Google, which I'm doing right now, and I'm going to put in TLIF surgery, okay? So it's a transforaminal lumbar interbody fusion. So if you put in TLIF, that's what comes up. Now, if you look on the upper left corner on the Google page, you'll see a little menu button that says Images. I'm going to click on it. And it shows images of what this looks like. So if you look at this, see, most people who get surgery don't know what they're getting into. If you look at this TLIF surgery, you're probably going to not ever want to do the surgery. And what I find in my practice, people that have had it, it's failed most of the time. I rarely have someone say, yeah, that was a great surgery. It must be a great surgery for some people, or they wouldn't keep doing it. But my Bible of medicine is do no harm. Okay? Do no harm means do conservative medicine first. If everything else fails, then you can go up the ladder and get more and more invasive if you have to. But I'm guessing, and it's a guess because I haven't touched this person, that this person's spondylolisthesis is not the cause of the pain. And if I do an examination, I can tell the person in about 10 seconds what's going on, because I'm going to touch the body. Most patients that come in with a failed surgery, I ask, did the doctor touch you to find out where the pain is being generated from? And the answer has almost always been no, they didn't touch me, they didn't examine me, they did an MRI or an X-ray and they showed me where the problem was. So the problem here, the person got an MRI, it showed spondylolisthesis, so they got an X-ray. They didn't say that here, but I know that, because you can't touch a spondylolisthesis. It's not going to show up in your exam. Who cares? It's not an issue. So within a couple of seconds, really, of touching and examining you, I can tell you, hopefully, where the pain is coming from. And in most cases like this, the pain is an enthesopathy. It's where the ligaments attach to the pelvis or to the vertebrae, and we can find that immediately and then inject it immediately and get rid of it. Very simple procedure, doing platelets and or stem cells. We do it all day long. All right, so this person goes on to say, however, in 2023, which is a year after the laminectomy, the back surgery, I got PRP on both my arthritic shoulder and knee with great pain relief. Oh, see? There you go. I want to try either prolotherapy or PRP for the pain of my spondylolisthesis. There they go. They keep going. Spondylolisthesis. It's hammered in their brain by their doctor that's their problem, and it isn't. Okay? It just isn't. We find spondylolisthesis all the time in people that don't have back pain when we're doing MRIs of the pelvis. It's sort of an adjunct finding. We go, hey, by the way, do you have any back pain? You've got spondylolisthesis. And they go, no, I don't have any back pain. So careful, 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 careful. When you get an MRI and you get a diagnosis from it and the doctor doesn't examine you, you're going down the rosy path to surgery that you most likely do not need. Am I a fan of surgeons? I am. They do the hardest work in medicine. Stick with me. We're going to a short break. I'd love to talk to you. If you call in, you'll get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And you can go to the website right now, which is www.jointrehab.com, and watch videos of me doing these procedures.
And we'll be right back after this.
Thank you.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, Call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.